Recognize now Representative Soter for a panel with Steve Mandile. Representative Soter from Bellingham.
Hello, committee members. I thank you for the opportunity. I don't normally make a practice to testify on bills that I have presented in front of our committee, but I thought this was very important piece of legislation to speak today. As you can see, the two other speakers before, the passion that 119 has. It is my hope that we'll get it done in this session. Steve's got his beautiful daughter here with him today because this is an important moment for him. I'm going to talk a little bit more personal on when I first met Steve. Steve grew up in the town of Bellingham. I knew his mom and his dad very well. Steve met with me when I was a select board member about opening up and talking about veterans, the availability, access for cannabis for veterans, but also what he wanted to do, what his hopes and dreams were, to have a cannabis facility that catered towards the veterans' needs and what they could do for the community. That time being a small town, Bellingham is being very new. I was a direct, probably opponent to having retail or any kind of retail in our town because we were very small. We didn't know exactly what was going to happen. We didn't understand the laws. We didn't understand all of these agreements that were being made. I've done a 180, and the reason for that is because I got to know Steve and his personal story, not just what cannabis does for veterans, but for so many across the Commonwealth. As a medical use, this does address some big concerns in our society, especially with things like opioids that we all try to sit here and battle every single day and talk about every single day. And every time we're on a budget, we increase that section of the budget. We're trying to increase that section of the budget. But there's one section that, one thing that we keep missing, we always go back to. Those folks that have an opioid disorder tend to utilize cannabis to help. This bill focuses on the criteria of qualifying patient. It identifies what that is. It identifies the post-traumatic stress disorder, veterans that we all know that veterans suffer from every single day. Just think about all these folks that came back from, I'll just use Vietnam as one of the biggest veterans that were coming back from the war that had serious drug issues when they came back, just from what they've seen of it. But because of the injuries and the injuries that they suffered and the PTSD they had. We had medical marijuana available to those folks. How many of them would have a different way of life today? And it also adds OUD, opioid use disorder, as a qualifying condition. This bill is very simple. It's very basic. It doesn't have any tricks or loopholes. It has what we exactly need to make sure that we take care of our veterans. Those that fight for our freedom every day. Someone who, like Steve, when he shares his story, will tell you the reason he did it because of that little girl, with other little girl. He changed his life. As scientists, we're asking this committee, I'm asking this body to do the same. I can change my mind on cannabis. We can change anybody's mind. So I want to thank the committee and I truly appreciate the time. Steve.
Thank you, chairs. Thank you, members of the committee. My name is Stephen Mandile. This month, actually 18 years ago, was being medevaced out of Iraq and was told by the Department of Defense and military physicians that I would live the rest of my life on medications, on pain medications and on medications for my mental health. It was, sorry for the pun, but it was a very tough pill to swallow. Didn't know that hearing that would then lead to a decade of trying to do everything possible that the VA offered, which included 57 different medications, 9 of which for opioids. The last 6 years of that decade, I spent taking fentanyl, Percocets, Xanax, sleeping pills, and a few other medications, and it made me the shell of the person I am today. Just angry and hurt all the time. Due to a failed suicide attempt, my wife gave me an ultimatum to try cannabis. At the time, I, looked down my nose at her and was like, I'm not going to sit around and do drugs. But sure, certainly enough, looked into what I was taking and learned that I was taking medical grade heroin in the fentanyl I was taking. I waited for dispensary to open, and about 6 months after first getting medical cannabis, I was off of all my opioids and was just blown away that this was possible and that this avenue was not being offered by the VA. In fact, at that time, if I had gotten caught with my medical cannabis, I would have been cut off of all my medications and forced to go cold turkey. I was fortunate enough to have a physician that was tired of sending me home with fentanyl each month. And she saw the damage it was doing and agreed to not have me drug tested so I could start using cannabis and taper off those medications. Without her help, that wouldn't have been possible. Without the family support system I had, my recovery wouldn't be possible. Unfortunately, last year, as early as last year, I had to have my spinal fusion redone and had my whole lumbar fused. And leaving the VA, I wasn't allowed to be discharged until I signed for my Percocets, even though I had made it clear that I would not be using Percocet or any other opioid besides any opioids to heal except for medicine besides cannabis. I did so, and I learned and heard from so many other veterans that have had the exact same story I've had, where having no purpose, having no desire, no goals in life, to then having their life turned around. This literally is something that gave me my purpose back, allowed me to be a father to 2 incredible young daughters, and it's just something I want all of my brothers and sisters in arms to have access to. So please, please consider voting this favorably and helping the veterans of Massachusetts. Quickly, there are about 75,000 veterans that are enrolled in the VA healthcare in Massachusetts out of the 300,000 veterans that there are in Massachusetts. Thank you.
Chair, we have any questions?
Excellent. Excellent. Thank you. Are there any questions from the committee? Well, seeing none, we just want to thank you, Representative and Stephen, for sharing your personal story. Thank you for your service and for the advocacy work that you're doing on behalf of veterans. We very much appreciate it. And thank you, Abigail. Was it correct? Good, for being here as well. Thank you so much. So we appreciate it. Thank you.